Hello, everyone. Welcome to another episode of Dr. Plano's Plastic Perspectives. Today is January 3rd. I hope everyone had a wonderful, happy new year, and hopefully everyone has a great 2025. I'm Dr. Jeff Angobaldo. I'm a board certified plastic surgeon, and I'm also known as Dr. Plano. Our plastic perspective today will be focused on dermal fillers. We're talking about the Juvederms, the Restylans, the Sculptras. So we're talking about dermal fillers today. Fillers are very popular. If you look at the two most popular non-invasive cosmetic procedures, number one is Botox/Dysport neurotoxins to help smooth out lines, but number two are dermal fillers. Then you have other things like hydrofacials, dermabrasions, chemical peels, but those are the top two by far. And they've continued to grow exponentially since like 2008. So it's incredibly popular. And as I always say, always go to a board certified plastic surgeon for any of your neurotoxin or filler needs, or someone working under their plastic surgeon. Dermal fillers, in general, they just, what do? It's basically restoring volume, smoothing wrinkles, enhancing facial features. They're really enhancing the appearance. And it really varies by different age groups. Younger folks in their 20s really like fuller lips. And that's where the volume comes from when we inject lips with filler. We also do almost the entire area. Men will come in and some females to help smooth out their jawline. And so we inject fillers along the jawline. We use it for cheekbones. And if people want to enhance their medial cheek or their lateral cheek, which is a little bit more popular, we use fillers for that. And when you think of the temple hollowing as we get older, or the nasolabial folds, the fillers are great to provide volume and to correct any concavities that people have and develop over time. So it's incredibly popular in our practice and most med spas and plastic surgery practices across the country. But there are risks, there are complications. But these fillers, it provides a real non-surgical way to rejuvenate and restore the appearance of the face and correct any issues that people may have. Some of the advanced techniques will inject the dorsal hump. And so, for example, if someone has a little bony protuberance in their nose, it's called the hump, the dorsal hump. We inject behind it and in front. And it creates a really nice, smooth contour to the nose. And so, it gives people a few years before they decide on doing like a rhinoplasty or a nose job. Or they can just keep getting corrections every year or two. And the reason why I say that is that these fillers last about anywhere between 6 months to 2 years, depending on the filler. Obviously, the thinner fillers that are injected into the skin don't last as long, within a year or so. The ones that are thicker, the volumas, and we'll address the different types in a little bit, but the thicker fillers are made to last longer, and they usually get injected to right above the bone. They're a little bit deeper in the skin, the injection plane, and it's really made for the cheek area, the temples, which is over the fascia, and nasolabial folds you can try. But there's also other fillers that last a year and a half that you can inject that are FDA approved for the nasolabial folds and the marionette lines. Yeah, it's super popular. Even little thin lines like neckline bands, those neck bands that some people get, or forehead lines that are static, meaning they're not moving and you're seeing lines or fine wrinkling or acne scarring. Fillers can be used to inject those areas, basically filling in those concavities. So its use is quite diverse for facial rejuvenation and non-invasive. You don't need surgery, anesthesia for all. One of the nice aspects of dermal fillers is that there's minimal downtime. Most patients could bruise. That can happen. We try to minimize that by, I always have an assistant holding a little pressure in the areas that we inject to minimize bruising. But even with that, it can still occur. So that's why a lot of our patients will do their fillers on the weekends, like on a Friday or on a Saturday morning. So they'll have a little, because some fillers, the older ones, cause a little bit more swelling. They're hydrophilic. Hydro, these are all like Greek terms, is water, and philic is love. So it loves water. So these fillers, they draw in water. So, and what's the consistency of all these fillers? It's hyaluronic acid, which is your natural skin sugar. And these sugars, just draw in water. That's what it does. So you can swallow little bits, and that's why we give everyone a little ice pack before they go home to help with the swelling. They'll use it for the next 3 hours afterwards. The downtime is little, so most patients will go out that evening on the weekends, or they'll just take the weekend off and just go to work. And if there is some mild bruising that can occur, they can easily place the makeup to cover up those areas. Because these fillers are hydrophilic, they contain the hyaluronic acid. Remember how it draws in water? So it really does a good job at hydrating the skin, improving the texture and the tone. So it just over time and just immediately within the next couple of hours, it helps kind of plump and rejuvenate the skin. It gives a more softer, more youthful appearance. In addition, when you're injecting the hyaluronic acid into the skin, the deeper part of the skin, it stimulates collagen production. So it helps to increase the skin, the elasticity or the firmness of the skin. So it has a lot of different uses, and I'm telling you, it's one of the most popular procedures. But there's always risks. And so we'll discuss the risks as we move forward with our discussion of the different types of fillers. There's two main companies for hyaluronic acid fillers. The first is the Botox line of fillers, which are called Juvederm, the Juvederm family. And if you're familiar with Dysport, the other competitor, Neurotoxin, they also have a line of fillers called Restylane. And so each of these two companies have about 7 different types of fillers within their family. The Juvederm family, you have fillers that are made to inject into the skin, and some that are more durable and they last 2 years, and those are made for the cheeks. That's where you have the names like Juvederm, Voluma. Juvederm Ultra lasts 6 months. Ultra Plus is a year. We also use Volbella, which I love because then you can inject it into the skin. You can treat areas like the tear trough or the nose region with that. It's one of my favorite fillers to use because you can actually inject into the skin without causing, there's much minimal risk of a complication called a Tyndall effect. Sometimes with the other fillers, if you're injecting it too superficially into the skin, you can have a blue tinge. It's not a bruise, it's just the filler. It doesn't happen very often, but there's a small risk with that. But the newer fillers and newer lines, the risk of Tyndall it's very, very low to none. Volbella is a unique filler because a lot of the skin thin fillers usually last about 6 months. Volbella lasts a year. Then you have the thicker fillers like Voluma, Velour, that lasts 1.5 years to 2 years, and that's usually a deeper injection. On the Restylane side, you have the classic Restylane L. It used to be just Restylane, but about 8 years ago, they added lidocaine to it. That's where the L component comes in. And before we used to do numbing blocks, all that stuff, but now these fillers come with lidocaine. So you'll feel a little numb afterwards. That lasts about an hour, but it makes the injection a little bit more tolerable. I think the most sensitive area is the lips, for lip volume. And I think that's the only area we actually use a numbing cream on. Because it's a little bit uncomfortable with the numbing cream for 10 minutes. It's a much more tolerable and easier injection for both the patient and myself. Now the Restylane line of fillers, the classic Restylane is actually a little more popular across the country for fillers. And their line of fillers, include the classic Restylane L, Restylane Lift, which is a little bit of a thicker filler, and it lasts a little longer than 6 months. It lasts a year. Then you have the define, refine. You have the contour, which is FDA approved for the jawline to create a really nice contour. And they came out with one about a year ago called Eye Lights, which is really made. It's like the competitor to Volbella, one of my favorite fillers to use, because you can inject eye light into the skin itself without the Tyndall effect occurring. And so I use that filler also for the tear trough and for the nose region. So yeah, I mean, like we carry both lines and all the filler options at our office. It just basically patient driven, whatever they want to do. A lot of times they accrue points with each of the competitors' programs. So when they come in for one injection a few months ago or a year ago, they accrued points and they get discounts towards their treatment. So it's basically whatever a patient decides and what fillers they want to use. If they ask me, I just give them my opinion and what I think would be the best. And there's a filler for each area that will address it. So for lips, Restylane has a great one called Kiss. It's made for lips, and it holds its volume. It's less hydrophilic, so there's less swelling associated with that. But it's one of my favorite ones for lips. And the Juvederm family has the Ultra Plus. You can't go wrong with that. So these fillers last about a year. But on the lips, it's a little bit different. So if anyone that's driving now or listening to this podcast, probably had some lip fillers in the past, and they were told they'd last 6 months or a year, depending on the filler, as we discussed, but only lasted half that time. And the reason why is the lips are very vascular, and you're always moving your lips all day. You're talking, you're eating. So when you're doing all that, moving your lips, there's more blood flow going to the area and it's dissolving the product faster. So for lips, I like using the fillers that last about a year or sometimes a little bit longer, so you'll at least get a 6-8 month correction. And the fillers that you place in other areas, like over the bone, the cheeks, or the temple region, truly last a year or a year and a half or 2 years, wherever their duration is, because you're not really moving those areas when you animate. So it's just lips are one of those areas that doesn't last as long, and that was the reason for it. There are complications with injectables and asymmetries. When we're injecting patients, a lot of people don't really realize that they're asymmetrical because half our body is different, half your face is different. Look really closely, take a picture with a camera. You'll see one cheekbone is more fuller. You have more muscle bone and more fat on one side in comparison to the other. So all that attributes to natural asymmetries that people have. And so really the fillers that we inject are only 1 cc. There's not much volume. So the more fillers people get, the better the result, especially if they need it. I'm a big fan that less is more. Start off with like 1, maybe 2, and then, if you want to do more, come back in 2 weeks versus just giving someone like 4 or 5 or 6 or 7 syringes at one time. And you can always do it in parts, especially if someone never had a filler. They could be scared about the amount of volume if you're injecting too much. So that's one complication. It's overcorrection. You're injecting too much into an area. But the nice part about the high hyaluronic acid fillers, the more common ones and popular ones, is that they're reversible. There's a reversal agent to it. So there's much less discomfort. Since there's a reversal agent, let's say if someone forms like a fuller area, or what if some of this filler becomes like a hard lump, which can occur. It's very rare also, but if that occurs, you can reverse it. I just saw a patient that was injected in Houston with a lot of filler for her hip dips. And so they used a lot. It's like 20 syringes per side or something. And it was about a year ago, but every like 8 weeks, she gets these areas that get red and swollen and painful. Then she's on they prescribe an antibiotic, a steroid, and it kind of tones it down and calms it down for the next 2 or 3 months, and then it recurs again. She was referred as a referral. And so what can happen if you're injecting a lot is that you can actually occlude some of the lymphatics, and that will cause some areas that get red and swollen and painful. But another thing that can occur, and that's why you always go to a board certified plastic surgeon, is you can introduce bacteria into the filler. So we always prep the area before we inject. We always use obviously clean needles, and so, it's called a biofilm. You're not that infected where you're getting fevers and pus, but it's enough that causes this little inflammation that occurs every 2 or 3 months, which happened to this one particular patient that was injected in Houston. So what do we do for her? We reversed it. It required a lot of reversal because there's only 1 cc per vial of reversal, so she had like 15 syringes or so placed per side. But either way, and that seemed to have helped her situation. But yes, hard lumps, lymphatic obstructions can occur. That's what causes the redness. And even, I guess, introduction of a biofilm or a small infection can occur. I think the most feared complication is skin necrosis, when you're injecting and you can occlude an artery or vein. If you're too close to the eye area or you're in the glabellar region, you gotta be very careful. You go to someone with experience because it can occlude like an artery, the angular or ophthalmic artery. It can cause blindness, so you gotta be very careful. And one thing that I've seen in my practice over 15 years, I can remember of 2 patients that had developed a little around their nasolabial fold, which is the area right below the nose, a little bit of skin slough. And that's the skin was a little compromised from the filler. And so the thing about that is that patients get a little bit of pain. And normally you get pain with the injections that last for a day because it feels like a hard little ball sometimes and it hurts with the swelling. And the next day it gets better, but this pain gradually gets a little worse. So I remember when that one patient called, I told her, come on in, and I reversed it right away in that one particular area, not the whole filler, and that relieved all of her symptoms. But if you let that go, someone that has like pain and there's an occlusion of an artery, they'll develop skin loss, like a wound. And the face will heal well, but who wants to have that complication? So you gotta be very careful. So every time someone comes in, before they leave, you gotta make sure you touch their skin to make sure there's good cap refill. Just like when you touch your skin right now, it turns white, you let go of your finger, it turns red. You're perfusing that area. So you have to kind of blanch and they pink up without the pressure. And that's usually our patients, before they leave their injection room, we test for that. Bruising will occur. That's very common with fillers. But I always have an assistant to put pressure. The key is to put early pressure right on, and that will really minimize any risk of getting bruising, but that will occur. It can happen. It's just the scary ones, and I can think of no one ever got blind, but that's what you read in books and articles. And I had like one patient with a little bit of skin slough, very superficial, that we reversed in the last 15 years in private practice. But yeah, so you got to be careful, And so always choose an experienced injector, someone working underneath a board-certified plastic surgeon or your surgeon yourself. Use your board-certified plastic surgeon for your injectables. I've had like a very small amount of patients, like 2 or 3, develop an allergic reaction to a filler, like a little bit of redness, itchiness, and swelling. And so, the treatment is always a Benadryl, antihistamine, or a steroid, and even a low-dose antibiotic, just in case, just to prevent any type of infection. But from my experience, it was the preservative they used in lidocaine that they were allergic to. So for that very small subgroup of patients, which is, one every like 5 or 6 years, we have to special order fillers from the company without any lidocaine. And they usually do well. And just for prophylaxis, we'll also write a steroid pack before they're injectable. But going back to bruising, one way to minimize it, bruising will occur, but we always tell our patients, if you're going to get an injectable or a neurotoxin like Botox, you want to hold off your fish oil for 2 weeks. Aspirin, NSAIDs, like Advils or ibuprofen, you want to hold off for a week. It actually stays in your system for a week, and fish oil stays for 2 weeks. And some folks were like, oh, I didn't take my fish oil today. Yeah, it's still in your system. You're still most likely going to bruise. So with those patients, we do them in 2 weeks. They come back. And that's always better. But if someone is on fish oil or aspirin and they don't tell their doctor, most likely they'll bruise. Sometimes a filler can migrate. Now you inject into the cheek and it goes a little higher or lower. So I mean that's seen that a few times, but not. It's also infrequent. I always say like make sure I don't like our patients massaging those areas too much because once I inject, the filler kind of usually stays. But some patients are instructed, and that's just whatever your injector tells you, your doctor, just listen to their whatever they recommend. I usually tell my patients not to massage those areas, but some tell them they can do it. I'm always afraid if you massage, you're going to migrate that filler to a different area. But let's say if someone does have an area that feels hard or it's a small lump, then I tell them, you can try massaging now, and that usually helps out a lot. But I haven't really seen too much of that ever. If the injection is very painful, especially around the medial cheek, you're hitting a nerve. So I always tell my patients, having a small needle through your skin hurts. I mean, I hate needles myself, so I would prefer to numb my face for a little bit before anyone puts a needle on me. But there's a nerve called the infraorbital nerve and also a nerve called the supraorbital nerve in the forehead area. But it's the infraorbital nerve that we inject around that area for the medial cheek and the tear trough area, and even the fold if you're injecting a little lateral. If someone has a lot of pain, that means you're in the nerve, and get that needle out of there, because if you inject, you can have like a nerve pain that can last for a long period of time. But if you just move that needle to a different area, they'll be fine, like within minutes or so. So always be attentive. Don't just like inject. We also advise everyone to always pull out a little bit. You're injecting, especially around the nasolabial folds or the glabella region, to pull back on the syringe to make sure there's no blood. Because if you are, then you're going to inject into an artery or vein. So you want to inject away from that area and redo it again. Sometimes we'll inject some lidocaine with epinephrine, like a little injectable for numbing. And also the epinephrine spasms all of the arteries around that area, and it provides more for a safer injection. You can also inject, there's a filler called Radiesse. It's pretty much calcium, I think hydroxyapatite. And, Radiesse lasts also about 12 to 14 months. Some of the other fillers, the hyaluronic acid fillers. But I'm always afraid of like something that's really foreign to the body. They may form granulomas or hard areas, and you can't reverse Radiesse. You can try massaging and injecting with steroids, but if you get a lump that develops, there's no reversal. So we kind of really don't utilize that filler too much in our practice. There is a filler that's that we use that's not a hyaluronic acid, and that's called Sculptra. I think the name is PLLA, polylactic acid. Sculptra is great. It's nice. It's made by the Restylane family, but it's not a hyaluronic acid. It's not reversible. But Sculptra is a deeper injection, and we dilute it with like 10 cc's of sterile water and also some lidocaine to help with pain. And when you do that, it's you can actually inject a little more superficial and over the bone. I still don't inject a product like Sculptra into the skin. I go always below. It's great to restore volume. It's one of my favorite fillers for the butts, for hip dips, and also for the face. And Sculptra is a 3-part injection. You're injecting every 5 weeks for 3 treatments. So for someone's face, we'll use 1 or 2 vials. They come back. In 5 weeks, you're at like 30% of your final result. It's not like the hyaluronic acid fillers where you're injecting, you see the result right then and there. But the Sculptra, the product, helps stimulate collagen synthesis and remodeling of the deeper skin. So when you're injecting, it actually will, over time, provide more volume and by stimulating collagen. So usually when you're injecting, it's 3 parts. You're injecting every 5 weeks apart, and every 5 weeks you're at 30% of your final result from that first injection. So these fillers, once you give your 2 to 3 treatments, will last about 3 years. It's a great filler. It's great for people with a lot of atrophy to their face. So because we're injecting sculpture everywhere, the jaw, the temples, marionette lines, nasolabial fold, just the cheeks, medial and lateral cheeks, it's going everywhere. And it works well, especially with 2 vials. And then we wait 5 weeks, you can see the difference that 30% makes, the results that we inject again. And usually the 3rd time they come in, they usually don't need anything. Or if we do, instead of using 2 vials, we'll just use 1. But patients are really happy, but it takes time. It's a 3-part process, but the results are long-lasting and they look really good. The old fillers back in the day, when I was in med school, like 30 years ago, it was the collagen dermal fillers, and no one really uses collagen. That's really fallen out of favor. Silicone injections, I mean, it's not really available to us, and you've always read about the illegal silicone injections causing people to die in hotel rooms. So yeah, I mean, just stay away from silicone. And I think if someone wants long-term fillers, I always say use fat. When we do when we're performing a facelift, facial aging has 3 components. The ligaments that the muscles attach to get a little bit lax. That's what a facelift helps correct. It also removes a little bit of lax skin too. But other components of facial aging that a facelift doesn't correct that well is facial volume. That's why when someone is older and heavier, they look younger. But if you have a heavy patient lose weight, they look their age. So as we get older, we lose volume, facial volume. Then look at, if someone's listening to this and you're in your 40s and 30s, 50s and 60s, look at your pictures of yourself when you're in your 20s and 30s. If you maintain the same weight or around close to it, you'll see how much volume you had. Or if you look at your children, you can see how much volume they have. So as we get older, we lose volume. So a nice complement to a facelift is fat transfer. So every time we do a facelift, I'm like, it doesn't correct everything. You're still going to have nasolabial folds. You're going to still, need some jawline filler, a little bit of fillers in general. But a complement to a facelift at the same time is lipoing a little bit and injecting fats. And once you give it a couple of weeks, and that fat will stay for years. So I'm a big fan of using autologous fat transfer. Autologous meaning it's your own tissue. And I'm a big fan of using fat. That's a thicker filler, you could say, using your own fat. So we inject that in the deeper areas. We also process the fat a little differently, and with smaller needles, we actually inject in the deeper part of the skin and even the middle part of the skin. So yeah, so that's more of definitely a board certified plastic surgeon would do. But that's definitely a filler or a fats. It's a great filler that lasts much longer than everyone else, and it's your own tissue. How do we minimize bruising? There's not much to do other than holding pressure and wholly preventing it. But if you see like a little bit of bleeding coming from the needle injection site, you put pressure on it right away. And we always give people an ice pack, and we tell them to use the ice pack for the next 3 hours. And obviously holding off any of those blood thinners, the fish oil, any blood thinner, aspirin, NSAIDs or aspirins. Everyone always gets a little red at the injection site. Obviously, you're putting a needle in someone's face, you're going to turn a little bit erythematous. You're going to turn a little red. That is normal. That usually goes away after a couple of hours, or even just within the hour or so. I think the key, dermal fillers are generally very safe. And it really corrects a lot of areas that patients are dissatisfied about, whether it be their jawline, their nose, the bump, their cheeks, their temple hollowing. But always give people realistic expectations, always communicate. That wraps up our podcast. Hope you learned a lot about dermal fillers. Thank you for listening. And follow us on our social media. If you're interested in a consultation about fillers, you can make it a consult through our website at drplano.com. And enjoy the holidays. We're going to have more specials coming up before Valentine's. So look out for that on our website and our social media. Take care.